Heroin addiction is a serious problem that is sweeping the nation and destroying lives. Are you or a loved one struggling with heroin addiction, but don't know what to do or where to start searching for help? Many people are considering methadone treatment for their heroin addiction, but the thought of treating drugs with another drug can seem controversial to some. There is a big difference between methadone and heroin, and methadone treatment for heroin addiction has proven to have effective results. We're here to tell you everything you need to know about how methadone is different than heroin, and to make this decision about addiction treatment as easy as possible for you and your family. First, let's discuss methadone. Methadone is a synthetic drug that is part of the opioid family, and it works similar to morphine. It was originally created during World War II by a German doctor. Doctors used it to treat pain. However, today it is used to treat heroin and narcotic addictions. Methadone affects the brain and the nervous system and alters the way the body reacts to pain. Unlike strong painkillers and narcotics such as codeine, heroin, hydrocodone, morphine, and oxycodone, methadone purposefully emits the chemicals that cause an intense euphoric high. Methadone can also be used to help treat heroin addicts by training their bodies to function without the euphoric high sensation. Methadone replacement therapy also helps to eliminate dependency from heroin. By replacing heroin with methadone, doctors can eliminate the withdrawal symptoms, which can be intense and cause relapses. Methadone therapy is only beneficial when it is administered in a medical facility by medical professionals. It should never be used as a replacement for support groups, therapy, or lifestyle changes. While methadone is not a cure for opioid addiction, it is used as a part of a treatment plan. These treatment plans change for different patients. While no concrete time duration is set for methadone replacement therapy, doctors suggest that patients implement the therapy technique for at least a year. When the patient is ready to stop their methadone replacement therapy, their doctor will slowly start to lower their dosage in order to prevent more withdrawal symptoms. Much like any other drug, there are some risks that come along with methadone if it is not taken properly. According to the Centers for Disease Control and Prevention, CDC, methadone is one of the most common drugs to cause prescription opioid overdose deaths. One reason for this is that methadone is a slow-release drug that can stay in the body for up to 59 hours. If someone assumes that taking more methadone than prescribed will result in an opiate high, they can easily overdose. Another reason that methadone causes so many overdoses is that taking it with other opioids, alcohol, sedatives, amphetamines, or antidepressants can also result in an overdose. Heroin is an opioid drug that is illegal and has no medical use in the United States. Heroin quickly enters the brain and binds to the opioid receptors. These receptors are in many different areas of the brain, including the areas that affect sleeping, breathing, pain, pleasure, and heart rate. Once heroin attaches to the receptors, it floods the brain with dopamine, which is what causes the euphoric high. Many heroin users describe this sensation as a surge of pleasure or a rush. Heroin also depresses the central nervous system, which can cause people to become drowsy, fall asleep, or even become sedated. Heroin affects the brain's reward system, which makes the drug highly addictive. In fact, only one use of heroin can have permanent effects on the brain. Heroin affects the brain's reward system, which makes the drug highly addictive. In fact, only one use of heroin can have permanent effects on the brain. Overdoses are a fatal risk of using heroin, and the overdose numbers are extremely high. When someone overdoses on heroin, their breathing slows down immensely, or even stops altogether. More than 115 people die every day from overdosing on opioids, and roughly 5 times as many Americans are using heroin than a decade ago. Methadone and heroin are similar in the sense that they are both in the opioid family. However, when used correctly, methadone can help treat heroin addiction because it is long-lasting and does not provide a euphoric high. Methadone replacement therapy is highly effective for heroin addicts, but it may not be for everyone. If you have any other questions about methadone, check out our site for more details.